Can doctors and hospitals be bad for your health? Today we're talking about how the most dangerous thing you ever hear might be your doctor's diagnosis. Welcome to Body, Mind, and Spirit. I'm your host, Dr. Dieli Pichardo Johansson. To explain what I'm talking about, I need to step out of the role of retired board-certified hematologist-oncologist and bring you with me to the day I became a cancer patient, which was not the day I received the biopsy results. It was the day I sat in front of a doctor, an oncologist. You can imagine the irony. I was an oncologist and I consider myself a very good one, but I couldn't treat myself. I was not allowed to prescribe the chemotherapy. Even if I knew what I wanted, I could not be the person responsible if an emergency happened. So I chose the most obvious choice, my business partner who had been working beside me for over 10 years. I arrived at the clinic that day, sat through my morning work. I was proud of myself about the way I was handling the diagnosis. I had just received the biopsy results a couple of days back, and my attitude had been, why not me? I've seen thousands of people face cancer before. I'm not special. I will get through this. And I sat with him and he started asking me the typical questions. Are you having any symptoms, any weight loss? When he got to the part about the past medical history, he asked the usual questions. Any history of hypertension, diabetes, kidney problems, heart attacks? I answered what I normally did. Proud, I said, nope, I'm the healthiest person in the world. To which he answered something that made me lose my respect for him a little, and I admit it, made me feel ashamed on behalf of all doctors. He snorted. He said, the healthiest person in the world? Snored. You used to be. Those words slapped me. A minute ago, I was a healthy person who was dealing with a cancer diagnosis. With those words, he put a stamp on my forehead, and for the first time it hit me. I am a cancer patient. Never again, for the rest of my life, will I be able to answer a medical questionnaire for my doctors, for health insurance, for life insurance, and be able to say I'm healthy. Forever and ever, I will be now in the medical system labeled as a cancer patient. I didn't react immediately. I just went numb, answered the rest of the questions on autopilot, continued working through my day. But by the time I made it to my house, I felt weak, like every muscle of my body had been drained of energy. And that was one of the eye-openers to me of how much damage a doctor can do without knowing it. How did I snap out of that spell and gain again my will to live and my identity as a healthy person? Stay till the end for the end of the story. So let's stop here for a moment. Did this doctor cast a magic spell on me? It certainly felt like it. He pronounced some words and like a dark energy came over me. Doctors don't realize that sometimes that's what our words can do. You may have never faced a diagnosis like that, but I want to ask you a question. Has it ever happened that you were feeling fine until a doctor told you you had an abnormal result and then suddenly you were feeling sick? Have you ever been feeling fine, but you hear someone who was with you got sick and suddenly, oh my God, now that you mention it, I'm sick too? Have you ever watched one of those drug company ads and heard the list of symptoms they're describing and suddenly start wondering, maybe I have that disease too? It's not your imagination. I want to bring you to a concept that is widely accepted in medicine, the nocebo effect. You may be familiar with the placebo effect. We take an inert drug, a sugar pill, and we believe it's going to be good. Therefore, we feel good. The nocebo effect is the opposite. It's a phenomenon where harmless substances or negative expectations cause harmful, unpleasant side effects. For example, I had patients who used to read the fine print of all the possible side effects they would get from a drug and get them all, even the ones that were almost impossible. I had a very difficult case of a patient I loved who was feeling perfectly fine until I told her, Your CAT scan shows your cancer had spread to the bone. And then within hours, she was bedridden in pain. And there's another example I have experienced in my personal life. The parent of a child who's causing trouble in school, and at first you're only seeing him as a quirky, full of life kid, and someone, a teacher or a developmental pediatrician, sticks a label on them and tells you, your child has ADHD, your child is in the spectrum, and suddenly you are unable to see past that label. We are casting spells on each other constantly with our words. For centuries, for millennia, thinkers have acknowledged a few facts. From Buddha, thousands of years ago, saying, we are what we think. With our thoughts, we make the world. To the Greek Stoic philosopher Epictetus, who said in the first century, you become what you give your attention to the same idea being repeated over and over by modern thinkers, all the way to the common law of attraction belief that what we focus our thoughts and energy on, we attract more of in our lives. If you think that this sounds hippie and completely crazy, brace yourself, because if law of attraction sounds crazy, quantum physics is worse. According to quantum physics, the simply powerful act of observation influences the universe at its most basic level. Quantum physics tells us that nothing that is observed is unaffected by the observer. And my favorite, before awareness touches it, it's all pure possibility. The moment consciousness enters, reality takes shape. That makes me think, what if the attention we pay to illness and symptoms is actually increasing illness and symptoms? Wait, dearly, you may be thinking, are you saying that we should ignore symptoms and neglect our health? Obviously, no. You're talking to someone who went through cancer treatment twice, including surgeries, chemotherapy, and radiation. So, no, I am not talking about ignoring symptoms, but there is a difference between your body speaking to you, you sensing something is off balance, then whether you neglect it or not is the problem, to when your body is telling you you are fine and an external source is sticking a label of illness on you. Also, there is a difference between using the label to your advantage, saying, I temporarily agree to the label because that is necessary in order to treat me and cure me, versus allowing someone putting a label on you that disempowers you. Conclusions. Everything we give our attention to will grow. That includes our awareness of well-being or illness. And then, what can we do about it? If this conversation resonates with you, please consider sharing it with someone you care for. I would love to hear what you think. Please comment, like this video, and consider subscribing. And then, what can we do about it? First, defend your identity as a healthy person. Never use the words I am in front of an illness. Don't say I am a diabetic. At the most say I happen to have diabetes. In Spanish, the verb to be is two different verbs. Ser means I am permanently. Estar means I currently am. If anybody ever tries to tell you you are a cancer patient, you are diabetic, you tell them, I am currently dealing with a condition. Don't let the diagnosis become your identity. So, how did I snap out of my trance? I still carried that depression, that powerlessness for several weeks. Then my surgery happened, the first one of 4, a very long surgery, 10 hours long. The second or third day after my surgery, when against your will, the doctors and the nurses are encouraging you to walk so you don't get blood clots. My sister was helping me walk down the hospital hall, and she said something that snapped me out of the spell. She said, thank God you have been always such a healthy person. Look how quickly you're going to heal from this surgery. And that was a blessing. It reminded me that it was not that I had failed at being a healthy person because I got the cancer. It was more that if someone had to deal with the cancer, thank goodness I had done everything I had done before to stay healthy, because that was going to allow me to heal better. I was not a sick person. I was a healthy person who happened to be dealing with a diagnosis, and thanks to my good health, I was going to thrive through it. That's what I would like you to bring to your diagnosis. It sounds simple. Don't let the diagnosis become your identity. But what happens when we are fighting against a system that seems to be rewarded for finding more and more what's wrong with us? The overwhelming majority of diagnoses in medicine are not as crystal clear. Medicine is fully biased into diagnosing illness.